Welcome to Medical Marijuana and Wellness. Today's topic is managing chronic and acute pain with medical cannabis. So let's talk pain. Chronic pain is one of the top conditions cited for long-term disability in the United States. It's a persistent pain that patients complain about and often is misdiagnosed primarily because it comes from one or two sources or two or more sources, so it makes it very hard for the doctor to pinpoint exactly what the primary pain point is because there's multiple pain points. Pain is interesting because it's a combination of a number of things. It could be something as simple as the emotions, the sensations, or the psychological factors that come into play, which triggers trauma, which triggers fear, which triggers stress. It also can have to do with a muscle response. You hit your finger, you stub your toe, you feel your heart rate goes up, your blood pressure increases, you're sweating. That's when you know that you're in pain. And also it brings on something called the fight, flight, or freeze syndrome, where you look at what you're going to do in a particular situation. It really triggers your reaction to many different situations that we find. Now, again, as we mentioned, acute pain is something that can happen where you may swing a tennis racket and you tear a muscle and it's going to hurt you. That will go away in a few months. Although if it continues, and especially if it is related to having a shoulder injury or some other knee injury or something like that, it'll trigger what's called chronic pain. This is something that lasts for more than 3 months. In either case, you're in pain, and it's something that needs to be addressed, and that's what we're going to be talking about. Now, how does medical cannabis work with pain management? Well, we know there's a number of studies, clinical studies, that have been done on chronic pain, on ALS, on epilepsy, anxiety, cramps, insomnia. Different states will allow pain and pain management to be one of the conditions that qualifies you for a medical cannabis card. What's interesting about cannabis as an alternative is for pain management is it's safe. World Health Organization has reported no fatal overdoses of cannabis, either used recreationally or medically. It offers an option for patients who've exhausted all the conventional therapies, and it also gives people that are trying to wrestle with opioids an exit, not an entrance, an exit opportunity to be able to manage your pain without opioids. Hemp is interesting, comes into play because both hemp and marijuana are classified as cannabis. Just like there's roses and there's different types of roses, cannabis has a couple of different varieties. One's called hemp and one's called marijuana. Now, hemp is defined to be 0.3 or less THC content. If it's more than that, it's considered to be marijuana. And that's really more of a less than a medical, it's more of a legal definition. So because by being 0.3% or less THC, it's now federally legal and it can be sold around the United States. If it's above that, then it's something that has to have a medical marijuana program because it's still federally illegal in the United States. Hemp historically has been used more for building material, ropes, hygiene products, although lately has been used quite a bit for hemp CBD products. Marijuana typically has been used to either get high and or by medical cannabis users. One is a tall, thin plant. That's what the hemp plant looks like. One is kind of a squat little plant. It's a bush. That's why they call it a weed. There is a difference between them, and they really have different medical values associated with them. Now, how does cannabis and chronic pain come into play? Well, because compared to other alternatives that you have, the number one reason that people turn to cannabis is because of chronic pain. It will lower your risk of addiction when you take a look at other medications that are out there. Again, there's no fatal overdoses. That's very, very important to point out. Cannabis does not hurt your body, as opposed to a number of medications that really attack your kidney and your GI tract, and there's also no issues related to liver damage. It's a very healthy alternative looking and very effective alternative when you look at pain management. Now, how do we know this? Well, in the United States, because cannabis is illegal, it's a Schedule I drug, the University of California did what they call a clinical trial, a clinical study, where they went out and actually found patients that were using cannabis for neuropathic pain and measured their response to them. And they found it was very effective. McGill University, which is in Canada, actually has done studies, significant studies, to see how cannabis can help relieve pain, improve sleep, and really help patients with refractory pain. In all cases, it's shown how cannabis, again, using studies, has shown that it does work. And in fact, in a 2019 study showed that 80% of the participants found that it was very or extremely helpful in managing pain. What has cannabis evolved to? Well, when I started looking at cannabis, I heard about the famous indicas and sativa. Indicas relaxing, sativas more uplifting. Really, we've evolved with the different ways cannabis is being produced, where they're now producing what they call chemotypes. Chemotypes are a combination of the strains as well as the terpenes that target a particular condition. So terpenes are very, very important because what they do is they bring the medical properties to cannabis. Cannabinoids are important because they target the various receptors and really introduce the terpenes to those particular receptors. So it's a combination of the terpenes, cannabinoids, and also flavonoids working together. And again, finding that what they call that sweet spot. How much do I take based on my individual body dosing? Every person's body is different, just like alcohol and just like caffeine. Some people can have one drink and be done for the night, and some people can drink the whole bottle and just be getting started. It's interesting that in the area of cannabis, it's important to go low and go slow, but find your therapeutic value or your therapeutic tolerance level. Once you do that, you'll know how cannabis is working. Your body will tell you, and you'll know exactly what the right dosing is for you. Now, how effective is cannabis with respect to pain? I'm not going to go through every one of these studies, but this is an example of a lot of studies that have been done on cannabis and pain. And I will point out almost all of these studies have been done outside of the United States because it's a Schedule I drug here in the United States. Let's play a little video from Sanjay Gupta on this subject.
Plus ingredients. The two scientists know the most about are THC, which is the psychedelic component of cannabis, which makes you feel high. And then there is CBD, cannabidiol, the non-psychoactive chemical. We've told you about this one for years, especially how it stops chronic epileptic seizures in young children. There is also research showing that CBD is particularly helpful when it comes to pain. In fact, CBD can do something opioids cannot.
With opiates, you're talking about killing the pain, masking the pain, you're done.
Dr. Julie Holland edited the Pot Book, a complete guide to cannabis.
With medical cannabis, you're actually not just talking about decreasing pain, but you're decreasing inflammation.
That's because opioids do a good job of interfering with pain signals going to the brain. But cannabis works on two receptors, one that blocks that pain and one that decreases inflammation. It's ironic that cannabis can do more than opioids, yet prescription opioids are legal and cannabis is not. Historically, that was not the case. For centuries, both cannabis and poppy, two plants, the natural forms of marijuana and opioids, were commonly prescribed by doctors and dispensed at pharmacies.
So it's interesting that we now have a situation where cannabis was put into this Schedule I status or made illegal more for political than for scientific reasons, and that's really, really important. So why is cannabis such a big deal? Well, when we take a look at our nervous system, which we all know we have one, and we've all felt it's been something that's a major part of our body and the way our body works, we know that if we hurt our finger, bang our knee, the signal is sent to your brain. I call it our nervous system being the cell phone system of your body. It goes up to your brain and says, Houston, we have a problem, and we have to do something about it. The question has been, what did Houston do about that? What we found out by studying cannabis is that our bodies have an endocannabinoid system. What does the endocannabinoid system do? Well, it's where Houston hands the problem to the endocannabinoid system, and this is where endocannabinoids are produced to help manage pain, anxiety, appetite, inflammation, and the immune system. Very, very important part of our body and in every mammal that's out there. Our body likes to stay in what they call homeostasis. That's a body that's in balance. It does that by using endocannabinoids, which it produces naturally in our bodies. So we, in essence, are producing our own cannabis. Phytocannabinoids, which are produced by the plant, have an interesting structure in that they identically match or look at and identify with the cannabinoids in our body. So if we're deficient in certain endocannabinoids, we can make them up by putting the phytocannabinoids from a cannabis plant into our bodies. And basically, binds to the same receptors and brings the same relief that we're looking from the endocannabinoid system. So in essence, it helps your body stay in homeostasis or stay in balance. Why would you need it? Well, for example, I'm a senior citizen and I don't produce as many endocannabinoids as I used to. So it helps that your body now has something that can manage itself and be able to get it into quantities that it needs. Now, cannabis itself is broken down into three parts: cannabinoids, terpenes, flavonoids. Cannabinoids, as I mentioned, are the ones that join with the receptors. They introduce the medical properties of cannabis to those receptors. The terpenes, which is really the strain and the smell and the taste, brings medical value, and is introduced into the body through the cannabinoids opening up the receptors. And flavonoids really give you the color and some of the taste that you find in the product, and it works great for anti-inflammatory, neuroprotective. It helps for disease prevention. So again, cannabinoids open up the receptors, and the terpenes and the flavonoids bring the medical value to your body. This is what they call the entourage effect. All of them working together, one and one is more than three. And that's what's really, really important. They working together, they synergistically help to enhance their medical properties. And a couple of things that are important. One of them is CBD, for example, lessens the psychological high effect of THC. So many people that are dosing, trying to figure out what their tolerance level is for THC, if you get to a point where you take a little bit too much THC and you're uncomfortable, take an equal amount of CBD and it'll bring you back down. It's something that helps you be able to counter that. It's what they call a rescue. It can be a rescue product. And also working with terpenes, it helps bring the medical efficacy to your body, and they work together to bring medical benefits. This is something that's really important. Now, we've heard about the different cannabinoids. Major categories are CBD, which is found in the cannabis plant. Again, we mentioned it's also found in hemp, and it targets the CB2 receptors. These are receptors in your peripheral organs and your immune system. Not psychoactive, but it really is great for inflammation. THC, or something called delta-9, is found in cannabis. It also is in quantities of 0.3% or more in the cannabis plant. Because it targets the brain and the central nervous system, it can have psychoactive effects, although they can be managed, again, by using CBD and by your dosing regime. But it's really important, especially if you're managing pain and you're trying to address certain issues like anxiety. CB1 is really important. Delta-9 is really important in part of that regime. Now, there's also something called delta-8. And what's the difference between delta-9 and delta-8? It has to do with the configuration of the molecule itself. It is less powerful than delta-9. In other words, it will give you a psychoactive effect, but it's very mild and it's not as high. A lot of people like to use delta-8 basically to try to use it recreationally, and you've got to take an awful lot of it to get it to work. I'm not a huge fan of delta-8 for a number of reasons. Primarily, it's a great product or a great cannabinoid, but the production of it in the United States hasn't been regulated, and you've got to be very, very careful with delta-8 products to make sure they have an up-to-date, accurate, and quality certificate of analysis. Looking at the CBD itself as a product, you'll find that here at CBD itself, as I mentioned, addresses not only the CB1 and CB2 receptors of the endocannabinoid system, but also a number of other receptors in your body. This is the ones that help you with blood pressure, for example, inflammation, helps you regulate pain through the body temperature. It also helps you with epilepsy and seizures, and also can help you with sleep. This is the byproducts of CBD itself. And what we're finding is it's becoming like it's like a super vitamin for your body. What are the effects? CBD handles more, as I showed, handles more of the receptors than just CB1 and CB2, but both of them, both THC and CBD, really work with the immune, peripheral organs, inflammation, and also your peripheral organs throughout your whole body. A key to being able to manage pain is to get the right terpenes. As I mentioned, the terpene profiles are really, really important. And the key terpenes to look for when you're trying to manage pain are limonene, as you can see, the anti-inflammatory property here, the pinene, which is great for pain relief, as well as anti-inflammatory, myrcene, caryophyllene, and eucalyptol. These are the primary terpenes you're going to be looking for to manage pain. That's found in what we call the cultivars. So there are different strains that have been put together, And if you look at the terpene profiles of the different cultivars that are there, like ACDC, you'll see the myrcene, the pinene, the caryophyllene that are in here. In the case of ACDC, it's a CBD dominant, meaning it's more of the CBD product. The other products are seen to be THC dominant that are down here. But it's interesting that CBD plays an important role, and that you can see the myrcenes, the pinenes that are in, caryophyllene are in all the different products that are out there. How do we take it? Well, there's really a couple of different ways. The nice part about cannabis is you're not stuck taking just one pill. You can use a sublingual drop, which you put underneath your tongue. Typically takes about 15 minutes to 20 minutes to work, and it'll last 4 to 6 hours. Or a spray. Same thing, you can put that inside the mouth. The blood vessels inside your mouth absorb it and bring it into your body. Very effective, and probably the easiest way to learn how to use cannabis is using a sublingual drop at a ratio of 1 to 1. Oral products are very famous. These are your gummies, these are your edibles, these are your chocolates. Very, very effective. They'll last for up to 10 hours. And that's what's key. If in the evening you want to be able to just sleep through the night, you taking something about 2 hours before bed will really, really make a big difference. Now, you've got to be very careful because oral products take up to 2 hours to work. And that's what's really important. About the time you think they're not working, the time you take another one is it starts working. You have to be very, very patient with both edibles and also with capsules. Topicals are very effective because you rub them on. Some of them will actually absorb directly into your brain, go into your bloodstream, and some of them will just stay on the derma on the outside. But they're very, very effective. Topicals work almost immediately and will last a couple of hours. And there's also patches that are available that can last up to 72 hours. Inhalation is the most famous way cannabis is being used. Smoking flower is one way. Using concentrates or inhalation pens are another way. Important to point out that cannabis is very sensitive to the temperature of which it's being burned in the case of inhalation. If you take that 500-degree flame and put it to the end of a joint, you're going to burn off half of the cannabinoids, all the flavonoids, and all of the terpenes. You reduce the medical efficacy of that joint down significantly, maybe over as much as 60%. That's the bad news. The good news is it still works. And so flower is one way of using it, but if you really are interested in that, buy a concentrate and use a concentrate pen. Again, it'll work almost immediately, but you can set the temperature of that pen. And based on being able to set the temperature, you can target various terpenes, as I mentioned earlier, the terpenes we're looking for, to be able to get the relief that's there. Many people who smoke flower say, I'm not getting any relief from pain, and yet they'll find out if they use concentrates, they do. And the difference is you're bringing out the best of the terpenes in that particular, with using a particular product. Examples are, for example, we talked about the pinenes, the beta-caryophyllene, the myrcenes, the limonene. They all triggered by lower heat. And by being able to have a vape pen that you can actually set the temperature on, again, this comes from using concentrates, or it comes from using a dry flower device that lets you set the temperature. It's really best for enjoying the natural flavors, bringing out more of the terpenes and cannabinoids, and really for a lot of newcomers, especially medical patients, this is the temperature setting that you want to set. As you set up higher temperatures, a lot of people will do this both for the limonene and also for the linalool, the relaxing aspects of that come into play. And you can see the high temperature marks down here, bringing again the beta-caryophyllene that are here. So the temperature setting, if you're using a vape pen, is absolutely critical. And most of the temperature settings, when you buy a vape pen from a dispensary that doesn't have a setting, is usually set to either medium or to high. And ask them which one you're getting. Very key to using medical cannabis. I want to thank you for taking the time to look at our video. To learn more about us, please follow us on social media, on Facebook, and also on YouTube. You'll also be able to tune in weekly to the Medical Marijuana and Wellness webinar series. On Wednesday nights, we host various subjects, and please join us for that. Thank you very much for joining me, and I look forward to hearing from you.